All right, in health news, for many people, the only time they visit their primary care doctor is when they're sick. But did you know they can actually help you with maintaining good health habits and more? Joining me from Spectrum Health Medical Group this morning to continue this discussion is Dr. Holman. Thanks for being here.
Hi, great to be here.
Okay, so you always get asked when you on that little sheet you fill out, who is your primary care physician? So what is a primary care doctor?
A primary care physician could be your family doctor, pediatrician, or for adults, internal medicine doctor, but they're your doctor that is kind of the first line whenever you have an acute problem, you get sick with a cold, like you mentioned, or a chronic problem like diabetes, hypertension, or some of those other things.
You have some pretty good job security when it comes to being a primary care physician, but it's not that you always want to see people in front of you, and after a while, maybe if they would just change their lifestyle, you could prevent them from coming in. So how can you help them with their lifestyle changes?
Well, that's a great question. I think, there's a lot of things doctors can do to kind of help you along the way with lifestyle changes. I think one of the first things is just having that conversation, where are you at, what are you doing, and where do you want to be at?
And that's the time for them to be open and honest with you about the way they live their life. Are you drinking? Are you smoking? Are you doing other things? So do you find that sometimes people are hesitant to talk about that?
I think so. I think, there's a little bit of fear. I think a lot of my patients have either kind of been talked to too much with their doctor. They kind of, are worried because they've tried things and it hasn't worked out before, or doctors haven't brought it up before because, I think sometimes we're so fast-paced that sometimes we don't take time to really talk about lifestyle.
Right. And one of the first things they do, too, is, can you please take off your shoes and step on the scale? And everybody just gasps a little bit.
Right.
But can your primary care doctor help you lose weight?
Oh, yeah, definitely. I think, it's kind of an incremental approach. I think it's something that takes time. So sometimes there's a little frustration because it doesn't happen as fast and quickly as we would like, but definitely they can help you.
What kind of tests are you running? You're doing some things to look at their heart and that sort of thing from the inside out, right?
Exactly. So, I think there's blood work we usually get if somebody's overweight or wants to lose weight. And one thing's a thyroid check, because the thyroid hormone's a real common problem with being overweight. And then checking for cholesterol and diabetes as well. And then if people are really going to start an aggressive physical, like doing a marathon that you guys mentioned, sometimes we'll check their heart, get an EKG and things like that to make sure their heart's ready for some of those lifestyle changes.
And everybody wants the magical pill. You go into stores and there's a weight loss section. So is there such a thing as a magical pill that helps you lose weight?
There's no magical pill. There is a approved medication called the Ally that's been studied that causes some minimal weight loss, but it's not a magic pill. And really the magic is diet and exercise.
There you have it. So the advice that you'd give somebody who says, you know what, I need to lose some weight, and I guess you could kind of tell that they need to lose some weight as well. So what kind of advice would you give them?
Well, I'd kind of see where they're at. There's a few simple tips that I say, drink lots of water, especially before meals, eat a good breakfast, things like that. But if they drink lots of soda, that's one of the first things we say maybe you could cut back on. But, it's kind of individualizing it based on what your patients are doing.
So it sounds like they can start with you, and if there's something that maybe you think they need more specialized treatment for, you have those connections, and then you can place them accordingly.
That's right. Yep, we do a lot of team-based care. So whether if it looks like they're not reaching their goals, we can get them into the bariatric surgery if they need that, or get into a nutritionist if they need a little extra help.
Okay. So how can patients get in touch with you?
Well, we're at 25 Michigan, right across from the Children's Hospital in Butterworth on the 5th floor there, and I think our number's up there, and we're on spectrumhealth.org as well.
Okay, so the phone number is really easy. It's 616-267-0800. Once again, spectrumhealth.org/primary care. Thank you so much for stopping by.
Thank you.
Have a great day.
Yep, you too.